Hi, welcome to part 1 of our 6-part series on how to read your own MRIs of the lumbar spine. I'm Dr. Andrew Brown. This series of videos is intended to help you understand what we as doctors are looking for when we review these images. I hope these videos will empower patients to have more informed conversations with their care team. These videos should be used for educational purposes and not for diagnosis. The first step is to download a DICOM viewer. DICOM is an acronym that stands for Digital Image and Communication in Medicine, and is a standard file format used for medical images. To make viewing and manipulating DICOMs easier, radiologists often use special programs. Today I'll show you how to download and install MicroDicom, a basic DICOM viewer that will get you started. First, go to the MicroDicom website. You'll find a link to the website in the YouTube comments below or in our AskWilhelm.com blog. You'll notice here in the choices there are 2 versions of the software you can download depending upon your operating system. If you're not quite certain which operating system you have, the best bet is to just go with the x86 version of the software. Click on that and it'll start downloading. Once it's downloaded, you can begin to install the software. Simply follow the instructions, and in a few minutes you'll be up and running. Now you'll want to open up the software. If you haven't done so already, insert your CD or DVD containing the images into your CD drive. If you notice that there's a pop-up or a program starts up as soon as you put it in the drive, just close and ignore those. We won't be using those today. In order to view your images in the program, simply go to File, Open CD. It may take a few seconds to load, but as soon as it loads, you'll be presented with your images. Now, likely the first set of images you'll see are what are called the localizers. And they're essentially a set of images that serve as a map. They're used to help the MRI machine determine when to start and stop to ensure all the anatomy is covered. And as you can see, if we just click on the image and I use my scroll wheel to scroll through the images, you can see that the localizer is really a set of snapshots of the area of interest in different planes, which we'll talk about in a minute. And oftentimes an MRI technician will use this to determine what levels to include in the images. This can also be helpful in the case where there is pathology or problems located outside of the field of imaging that we're focusing on. But today we're focusing on the lumbar spine. Just a quick note about the software. You'll notice that as we scroll through the images, you can sort of keep note of what image number you're at. And sometimes this is helpful just so you can kind of keep straight in your mind what direction you're moving in as you scroll through the images. So we've described the localizers, but as you notice, there are a number of other what are called sequences that are seen in this study as well. The American College of Radiology describes 3 types of images that must be included in every lumbar MRI. Those are sagittal, bright fluid, sagittal, dark fluid, and axial images, which can be of bright or dark fluid. So here we have T2 Sag. T2 is a bright fluid sequence, and sagittal gives you a sense of the orientation. So here we've opened up our T2 sagittal, image 20, scroll through it. As you notice, this is a T2 weighted image, and as such the fluid is bright. Here we can look within the spinal canal. We see the cerebrospinal fluid, which is bright. And we know this is a sagittal image because sagittal is the plane in which, imagine you're dividing your body in half, straight down the middle. And that's what sagittal means. You can check out our blog for a more detailed description of sagittal, the sagittal plane. So this is sagittal bright fluid. We also have sagittal dark fluid. So this is a T1 sag. T1, again, is a dark fluid. See the difference between T1 and T2 images? The CSF, or the cerebrospinal fluid, that surrounds the spinal cord and the nerve roots here, is dark. And that's what distinguishes, what helps to distinguish T1 versus T2 imaging. It's a bit more involved than that, but we'll leave it at that for now. And again, this is a sagittal image because here we're dividing the body sort of straight down the middle. There are other bright fluid sequences beyond just the T2 that we described. Again, T2. If I close these here, we also have sagittal stir, which is another form of bright fluid. So as then you can see here, in the spinal column, the cerebrospinal fluid is bright. So we've just gone through 3 different types of sagittal imaging of the lumbar spine. The other form of, or the other plane of imaging that we use often is axial. So this is a T2 axial image. So axial images is almost as though you're dividing the body up and down, kind of cutting it straight in half. And again, you can take a look at the blog for a bit more information on the different planes. But this is again a T2 weighted image. As you can see, the cerebrospinal fluid is bright. So that helps us to distinguish the different types of sequences, MRI sequences. And here's a T1 axial. And as you can imagine here, the CSF is dark. The fluid within the spinal cord is dark. So this gives you some sense of the differences in the sequences that can be captured in a lumbar MRI. So that's it for part 1 of this 6-part series. We've gone through how to install a DICOM viewer, and we went through some of the basics of lumbar MR imaging. In the next segment, we'll talk about the intervertebral discs and some of the pathology that happens there. If you have additional questions, please feel free to leave a comment here on YouTube or on our blog at askwilhelm.com/blog. Thanks.